the Reactivating New Patient Report of Findings, or ROF, we dove into this at the last seminar where we talked about the reactivating new patient. This is the report of findings for that patient. And what's important in this section is to realize that you can't come out and just robotically say things that you've said to a new patient for your reactivating new patient. They've heard it. So what I want to emphasize in this section is to make sure that you understand the patient's mindset. Their mindset is, I've heard it before, I understand it, I know it all. Now, you and I know they don't know it all, and they probably don't remember even half of what they learned before, because if they did, they never would have left. They would have maintained chiropractic care as a priority in their healthcare package, but they didn't. They had a change in priority. So we want to gently and encouragingly guide them into a new care plan. And that means going back and reviewing their very first visit, original primary concerns, the things they came in with for the first time, and then letting them know, here's where we're at now. Now, what do you think is going to happen if you don't take care of your subluxations? Are they going to get worse, or are they going to get better on their own if you're not taking care of them? Well, obviously they're going to get worse. They're going to go downhill. So we want to remind the patient of that this is a condition that requires ongoing supportive care to maintain an optimum threshold of health. And by reminding them of that, and then asking them, since you haven't been taking care of your condition properly, what do you think is happening? Is it getting better or getting worse? And they're going to say it's getting worse. So remind them of that, and then let them know, look, I'll take care of you in any capacity you want me to. However, I just want to make sure that if you're going to work with me on this, and we're going to agree on some expectations, in other words, I'm going to lay out where I expect to be able to take your spine to, and how I can help you to correct and stabilize your subluxations. If we can agree on that today, if we can agree on where we want to get to with point B, this being point A, I'm going to count on you to follow through this time. Because what I don't want to do is end up 6 months from now and have you saying, hey doc, why isn't my condition stable? I thought it was fixed. Why am I in pain again? I want to make sure that we paint that out now, explain that now, and then make sure that when we move forward that we're doing it together with a common goal in mind that we both agree and understand. So if you can do that in the Reactivating New Patient Report of Findings and explain it to the patient in that way, you'll have agreement at the front end, you'll both know what expectations you're working towards, and there won't be any misunderstandings, and then you won't feel like you're just repeating the same thing over on deaf ears if they come back again down the road. So use that, explain that with your patients, work with your patients, remind them of where we left off, what our expectations were last time, set up new expectations, and you'll have a great patient. They'll be with you for lifetime care, 1 year at a time.